Children are the foundation of any nation, and their survival is one of the country's indicators of growth and development. On the 16th of June, Uganda commemorates the African Child Day. But who is an African child in Uganda?
An African child is, in terms of health, is a child who's not well nourished, is an unhealthy child. Currently, that's what they are. They are malnourished. They don't have access to all the health care that they should be having.
An African child in the context of health is a child who is living under difficult conditions where challenges outweigh the solutions. An African child is one that is living in a household where there is little food to eat.
Uganda is one of the countries that still faces a challenge with its maternal and child health systems. According to the World Health Organization, maternal mortality ratio stands at 418 deaths per 100,000 live births, whereas under 5 mortality rate is at 135 per 1,000 live births. What does this translate into in terms of policy and resource allocation?
If we were purely on technical basis of drafting policy, I would think that government would have put more money in health, given the high maternal mortality, given the high child mortality. However, I think this is not what we are seeing. For some years, I think there has not been any substantial increase in the budget for health sector. And this is translating into declining indicators.
Safe motherhood practices and child survival programs are critically important in a country that is experiencing high infant and child mortality and maternal mortality. In Uganda, clinically diagnosed malaria still remains the leading cause of morbidity and mortality, accounting for 25 to 40% of the outpatient visits to the health facilities. The evidence is stark, and the reality is shameful. Though the government, in partnership with non-governmental organizations like World Vision, have designed malaria control interventions like malaria campaigns and distribution of free bed nets, but a lot is still desired. The question that still remains is, how much is the public informed about the spread and prevention of malaria?
Ekireeta omusujja nsiri na bidiba bino ebiri okumpi n'awaka ebibirabira amazzi ago ebibwe bityo kale byebisinga oleeta omusujja.
Knowing how it spreads necessitates knowing how it presents in children. How do mothers tell that their children could be suffering from malaria?
Omwana okumulaba nga alwadde omusujja mukwatako nempulira nga ayokya oluusi nga akankana oluusi n'omwanimere nga asesema.
Management of child health should be a collective effort at household level, especially by both parents. But where is the challenge in this?
The male partners or the parents or the fathers of the children, when their wives come to hospital while pregnant or in labor, they are never there. If those who are very good, they bring them to the health facility and take off. In the disguise, let me go and look for money.
But what do some of the men think?
Kusaidia fe y'abaami singa NGOs zino zongeramu n'afa abasajja oba abaami okusomesebwa okwongera okumanya obuvunaanyizibwa obw'omwana kyandiyambye nnyo okutumbula ebyobulamu mu maka.
This Health Center 3 in Kasawo in Mukono district is a government-owned primary health care center providing both preventive and curative services, and it is supported by World Vision. It supports a population of not less than 15,000 people. Among the facilities at this center is a maternity ward with about 7 beds, a pharmacy which mainly dispenses antibiotics and antimalarials, and a laboratory. The health workers work tirelessly, but they are overwhelmed by the number of patients, many of whom are mothers and children seeking antenatal care services and reporting malaria respectively. Patients queue for long hours, and those who get tired have no option other than taking naps on the grass and on the floor, waiting to save their dear lives. And for the children, sad faces and hunger strikes. Unfortunately, the long wait does not guarantee a patient the necessary treatment, as narrated by this mother. But the patients think there should be some steps taken to improve the situation.
Kyagala baneba batukwatiremu kuba obugayavu bungi nnyo babatugambireko bongeremu amaanyi kuba omuntu okujja n'ojjirira ekintu naye ate n'oddayo nga tokoze ekito kifunye ogwamu naawe amaanyi.
At this health center too in Chigogoro, Kasawo, records show that malaria remains rampant among pregnant mothers and children. However, malaria is presumed to have a synergistic relationship with malnutrition. How is malnutrition handled at this health center too?
We advise our mothers to use balanced diet by advising the mothers to use kitobero in our area. They mix beans or matoke and the other types of food so that it becomes a balanced diet. And we also advise them to use those fruits.
The mothers may be advised, but Paul, a World Vision Program Manager, feels there is a greater challenge to nutrition than just information dissemination.
In the recent past, given the globalization and the monetization of our economy, people have taken to selling food. So now the practice, which I can call a culture because this has existed probably for about 15 years now, we're actually selling the food. The vegetables fetch a very high price on the market, and the parent is more concerned about the money to get things for her children. She's concerned about getting the money, and these are the key ingredients in a child's diet. And this really affects us so much. So what is left at home are the high carbohydrate foods, which are not very critical for child development. The vegetables which have the vitamins and things like which contain iron, the pumpkins, these are all on the roadside markets. And so this has really greatly changed. The children are left with basic food, not the variety that they need.
Malnutrition may be one of the existing problems, but at this health center too, several challenges are hindering its efficiency and effectiveness. And what could these be?
We are lacking the lab so that we don't have the proper diagnosis of malaria. And at times we lack we are lacking gas, so we don't have. At times we don't immunize. Like today, I have not immunized pregnant mothers.
But all these threatens the survival of so many children. Not leaving it to the government alone, World Vision, a non-governmental organization, has been very instrumental in reaching out to the communities through health education and provision of preventive services as stipulated by the World Vision Director.
World Vision is primarily an organization that partners with communities to build their understanding of how to secure the well-being of their children. We do some nutrition awareness raising. We do awareness raising on the health, prevention of malaria, on the need to make sure children are enrolled in school and are kept in school, on the role of community to support the school system so that children can enjoy good quality education.
The community people pride in the services offered by World Vision.
Bitufunya nnyo emisomo kuva mu World Vision naddala egikwatagana n'omusujja.
Programu yaffe ya World Vision yatufunira ku butimba naddala buyambe ku baana.
In Nakasongola, a region with a population of about 143,000 people with scattered settlements, is an area known for cattle keeping. It has long periods of drought, which affects the farming and feeding practices in the area, as narrated by Mr. Kadobera, the World Vision Program Manager of Nakasongola.
Nakasongola is an area that is affected by prolonged droughts, and in the process you find that the community struggles with getting food.
Through its strengthened and broadened scope of operation in Uganda, World Vision has also put focus in the community of Nakasongola. Working closely with the district authorities and community people, World Vision set up Wampiti Health Center 2, located in Nakasongola, which serves a monthly clientele of about 300 patients per month, as shown by the records. But how much funds and medical supplies are allocated to this center?
We get vaccines from the district and some PHC funds which they give quarterly. Usually they send at once around 200,000 per month. This money, 50% goes for drugs and 50% manages other activities in the health center.
With that breakdown, what do the district authorities think about this in terms of planning?
In Nakasongola, our health center 2 has been getting about 200,000 to buy drugs for the health facility. And for quinine, is the second line drug for malaria, which I said that malaria is the leading cause of morbidity. And a tin of quinine of 1,000 tablets is about 125. And they don't sell half, so you have to buy a full tin. So if a health center 2 buys 1 tin of quinine and 1 tin of cotrimoxaz or Septrin, that means it will have remained with about, because cotrimoxaz is about 65. That means we were talking of about 190 period. You have remained with 10,000. Whether you're a good planner, whether you're a good prioritizer, you cannot make the health facility run or have adequate drugs.
Looking at the health center, many of the facilities used were donated by World Vision. Many of the patients who come to this health center report malaria, but due to long distance to the health center, some opt to stay at home. However, outreaches are conducted, but with some hardships.
We are running 4 outreaches belonging to this health center. So far now we are failing because much assistance was given by the World Vision by supplying us with fuel. Now there is no fuel. The only bicycle we have is down. Then the roads, some are impassable. Like the village outreaches at Kaliokoti, Malengera, we follow the footpath of cows. And during rainy season, it's very difficult.
Many of the supplies like gas to run the cold chain and the vaccines are transported from the district to the health center on bicycles. Though the staff are committed to serving the community, the facilitation and motivation should be considered paramount. Planning of maternal and child health services should be a participatory process involving listening to all voices. What is the attitude of children towards health workers and the services offered at different health centers?
The doctors and nurses really care, but the problem is the drugs. For they can care, but when you have nothing to cure you, then there is no any good work done for that.
But a different opinion is set in.
Those nurses or doctors, they are not fair to us children, because in fact they don't favor us children, because when we go there, they don't treat us as people, as children, because they know that we are children. We can't say anything about them, because for them they are what? They are big.
When the people speak, it shows a felt need rather than a perceived need. What do people think that government should do to improve health services in the area?
The government should improve our health, we as children, by bring more drugs in the hospitals and health centers around where we live, and taking care and inspecting the doctors and the nurses to avoid the use of the drugs before they reach the people who are concerned.
In Uganda, management of children's health, especially malaria management, will necessitate an integrated approach centered on livelihoods, environment, and the health system. But is this a shared view?
So I would believe that the integrated approach would be the best. And it would not really take it as an issue of health alone. Malaria, no. It is an issue of works. For example, when they are constructing their roads, they should not create ponds which are going to create stagnant water and bleeding places. It should be something of fisheries production. As they are breeding their fish and whatever, then they should bear in mind. It should be really like HIV, where we say that it should be streamlined within all sectors. I believe even malaria.